Hello everybody. I know I shouldn't stray into politics, but it's hard not to at the moment, isn't it?
Struggling with their bills, why do you want to make it harder for them by saddling them with £2,000 worth of higher taxes? How is that going to make Paula or anyone's life easier?
Could you respond directly to Rishi Sunak?
This is the Prime Minister who's been part of a government that has put up tax 26 times.
Rather than having a rant about how awful our politicians are and how much they seem to disrespect and even hate us, I thought I'd look at what the incoming Labour government plans to do to help people waiting for much-needed joint replacement surgery. If you live in Britain, you'll know how much we value the NHS. The founding principles of universal health care and treatment, free at the point of need, transformed this country after the war. We can argue, of course, until the cows come home about how the NHS has been politicised and how much it's changed for the worse, but when you're faced with a life or limb-threatening problem, it's always there, and thank goodness for that. The pandemic, of course, 4 years ago changed everything. The NHS imploded. Waiting times for elective surgery like hip and knee replacements shot up. And because our population is rapidly getting older, the demand for these treatments is, of course, relentless. Workforce, recruitment and retention problems are getting worse, and morale is the worst that I've ever seen it. So what will Labour do to change things? Well, none of these problems I've mentioned will go away anytime soon. The only way that more people can be treated is to increase capacity. Plans include the expansion of up to 50 surgical hubs. These will do elective cases only, so there should be fewer cancellations because of emergency cases. One of the problems with acute hospitals, of course, is that beds get blocked because there's nowhere suitable to discharge often elderly, vulnerable people who are recovering for treatment for long-term illnesses. Careful patient selection for the surgical hubs should help get around this problem, but even so, there'll have to be a big increase in the care sector to cope with the demand. Labour will have to hold its nose and use the private sector more and more to get the work done. Blair, of course, opened the door to public-private working 25 years ago. It's never gone away, and of course it works very well. I see and treat NHS patients every week at the Nuffield. Everybody benefits. This, of course, begs the question of where's the money coming from and who will do the extra work? We all know the economy is under strain, to put it mildly. Taxes have never been higher, and seemingly uncontrolled immigration is a big worry for many people. As far as I can tell, none of the major parties has a clue about what to do about these elephants in the room. Politicians, of course, love to talk about the savings that will be made by improving efficiency, but in all the years that I've been a doctor, it's just so much hot air. Don't work harder, work smarter is what they say, but frankly, that's insulting. Delivering healthcare is not like making things in a factory. What will I do? Well, I'll keep on turning up, looking after my patients to the best of my ability, and work with the hospital management to make sure that we make the most of our precious resources. I won't compromise. Keep the faith, everybody. Thanks for watching. Let me know what you think, and I'll see you next time.